Welcome dental students again to our last night dentistry series on oral surgery. Now we have to discuss about the topic asthma and hyperventilation. It is also an emergency in dental practice. So please, make sure to subscribe and, like my videos so I have some motivation to do a lot for you guys. So that's it is. Now going on to the topic, we have to understand that it is also an emergency. So we have to explore how to manage acute asthma attacks and hyperventilation during treatment using the step-by-step guidelines given in our book. So here it is starting, they're just giving to an introduction that many patients will come with respiratory problems like COPD, asthma, hyperventilation, and how we have to deal with them. So part one is we are dividing in these respiratory problems in parts. So the part one come in asthma emergencies. So basically, first I have to tell you guys how it happens. Okay, so we are covering uh, asthma first of all, and sorry for the Okay, so first we are covering asthma, and first we have to understand how it happens. A patient with asthma may start coughing and breathing rapidly in the chair. Okay, just imagine a patient. Emotional stress, anxiety, or even a medication like aspirin can trigger this attack. So we have to keep this in mind. So the signs you will notice is audible wheezing, shortness of breath, tachypnea, tachycardia. Okay, so and if it goes untreated, progresses to cyanosis, mental confusion, and even loss of consciousness. So these are the signs you will notice earlier. Okay, so shortness of breath and all these things. So the next thing that we have to consider is just wait a minute. Okay, so the next thing we have to consider is management protocols. So what we have to do immediately after this. These are the management protocols. So what we have to take care of in the management protocols. So we have to stop all the dental treatment, okay, as we have discussed earlier, and then sit the patient fully upright, help patient use their bronchodilator spray of an albuterol given here, and then we have to administrate oxygen via a nasal or a mask, and then monitor vital signs. So these are the things we have to take care of. Okay, uh so this is until if the patient improves. If the patient improves, refer them to their physician before continuing any treatment later. Okay, so we don't have to go for the treatment until the patient doesn't meet his or her physician. So that's how it goes. But if there is no improvement, so now we have to do escalated management, and how it works is by administrating epinephrine written here 0.3583 ml. Okay, and then we have to continue the oxygen and start IV line with 30 ml per hour crystallite drip. Okay, we have to take care of this and just monitor his or her vitals closely. So if let's suppose if there is still no improvement, prepare for emergency transfer. Okay, severe attacks can lead to full respiratory arrest, so we don't have to let the patient go in there. So that's how it is, and they have summarized it below that the patient uh, just say, let's say your patient is a 28-year-old woman with a history of asthma during a crown preparation. She starts breathing fast. Now says she feels tightness in the chest and you are hearing the wheezing sound. So what you will do, you will stop, sit her up, okay, stop the dental treatment, and what you will do, position the patient in sitting position. Okay, this is very important in respiratory problems. Then you will ask the patient to use her inhaler. Okay, you have to ask her to use her inhaler, and then with that, administrating oxygen and monitor vital signs. So, as I have told, if the symptoms relieve, so we have to just monitor him or her during the recovery in the office, discontinue IV lines, and we have to know for the dental treatment until the patient physician approves. This is something important that we have to understand. Okay, so the next thing coming up is if the signs and symptoms continue as I have told, we have to go for epinephrine and a crystallized solution drip, and if after all these things there is no relief, then we have to call for emergency assistance. Okay, so that's how we have to deal with asthmatic patients in our dental office. So I hope you guys got the point, and it made you guys feel that I have given the concept of how to deal with an asthmatic patient. So this is something very important. We have to learn about how to deal with asthmatic patient. It is something you have to go through first. Go through these lines and they are summarized here. Okay, so the next thing we got is hyperventilation. It's a part two of respiratory problems and how it happens. Just imagine a younger patient, especially in their teens, or he could be in his 20s, may panic and start breathing too fast. Okay, so he is breathing too fast. This is something I have given, it is written here in his team. So he is breathing too fast. So this is the key word or key line you have to understand for your exams and clinical practice. That this is not asthma, it is hyperventilation caused by anxiety. Okay, so anxiety and teens. If you got any scenario with such keywords, you have to who they just consider it as hyperventilation. Okay, so what is key different between asthma and hypertension? It is basically over breathing, okay, not under breathing. So you will notice rapid shallow breathing, lightheadedness of the patient, tingling in fingers, chest tightness, and a sense of panic. Okay, so and here are some manifestation of acute asthmatic episode, like that's how you have to go read and learn this table. This is very important for asthma. Okay, so these are like the signs you will see in an asthmatic patient. Okay, coming up next, continuing hyperventilation. What's next? Okay, so basically now what is the management during hyperventilation? So first of all, it is like reassure the patient. Okay, so first step is reassure the patient, tell them they are safe, and stop the treatment immediately, and then encourage them to breathe slowly, either into cupped hands or a mask without oxygen. Okay, this is important. Encourage them to breathe slowly. Okay, the next step is never give oxygen in hyperventilation. It makes it worse. So okay, this is very very much important point, that we don't have to give oxygen to the patient with hyperventilation. Here is the anxiety reduction protocol. It's like just reassuring him, and the patient breathes rapidly. Tachypnea, it's most important sign and symptom. As I told, tingling sensations, all these things are seen here. Okay, so this line. This is such an important line. Oxygen enriched air is not indicated at any cost in hyperventilation. If symptoms persist, use mild anxiolytics under supervision or refer for a medical help. It is given here a sedative. So that's how we have to manage uh, hyper a patient with hyperventilation, semi-upright position, sitting position. I have told you all these things. The most important key point is this oxygen rich air is not indicated in hyperventilation patient. Okay. So anxiety manifests as hyperventilation. This is something you have to remember too. Okay, so I'm gonna give you some, MCQs point of in this two topics we have learned in asthma and hyperventilation. So the first tip in asthma attack, what's the first thing to do in a bronchospasm? Okay, so when we have to deal with, respiratory problems, we have to terminate dental procedure and place the position in upright position. This upright is very, very important. And what is the first line medication for asthma emergency? So always remember is albuterol, the spray the patient brings, or the epinephrine 0.3 ml. And what is the most common cause of hyperventilation? It is anxiety. Okay, anxiety is something that triggers hyperventilation. Oxygen in hyperventilation is super contraindicated, and respiratory signs in asthma are cyanosis. Okay, so that's how we have covered our part two of an respiratory problem. Now we got okay. So I have just skipped something here. That what is hyperventilation syndrome? Okay, so it is the most common respiratory problem in dental clinics. Okay, as I have said, it is triggered by anxiety, especially in young adults. What happens? It is quite general, rapid breathing, tachypnea, tingling in fingers, lips, dizziness, and may progress to muscles. And as I have told, we have to stop the dental treatment. Okay, and if it gets severe, we have to go for anxiolytics, midxolam, and all these things. Okay, so that's how it is. I hope you got the concepts of hyperventilation, hyperventilation syndrome, and the next thing are and here's the table for hyperventilation syndrome, which is quite important. That what could it lead to, dizziness, syncope, tingling, or numbness of this is something you have to learn because how it affects our brain, how it affects our lungs and our heart and our muscles. That's how you have to memorize it. Now, I guess now we are going for COPD, also known as chronic obstructive pulmonary disease. So, patients with COPD have a fragile breathing drive. Okay, they rely on low oxygen to trigger breathing. Too much oxygen can actually make them stop breathing. Okay, so you have to understand the difference between COPD, asthma, and hyperventilation. So, the risky situations may are like lying almost flat, high flow of oxygen, excessive secretion, using accessory muscles to breathe, cyanosis, or with too much oxygen. So these are the things that could risk in it. Okay, so here are relevant that the patient uses accessory muscles, high flow of nasal oxygen, and all these things are given here. You have to go through these lines. Okay, so what's the management, what we have to do? Okay, so keep the patient upright as we have discussed before and avoid high flow oxygen. Okay, in supine position and avoid high flow oxygen. If oxygen is needed, use low flow carefully. Okay, this is an important point that we have to use low flow of oxygen, and monitor for change in symptom, cough frequency, difficulty in breathing. So these points we have to understand that we have to monitor the sputum too. We have to see that there is change in sputum or not. Okay, for emergency surgery, give bronchodilator prophylactically, consider referring to OMS specialist. If patient become apneic and stop oxygen, start BLS, call emergency help. So that's how it is. Okay, so these are things you have to. Elective surgery should be postponed, and these are the lines you have must have to go through while reading COPD. So the management is quite simpler. That also stop the treatment, okay, and make the patient sit in upright position. So what happens if COPD patient is given high oxygen? Just think about it. Apnea may develop. Okay, the patient may become apneic. So this is an important point in a COPD patient. I hope you got the concept of the three parts of respiratory problems, including asthma, then hyperventilation, and at last COPD. So they differ from each of them, but the things same are like that we have to stop the dental treatment every time and make the position sit in the upright position. I hope you have got some knowledge from this video, and the lines I just got highlighted or underlined, you have to go through them and just give them a read and just listen to my lecture. You will get benefit by it, and if you like the video, just give it a like, subscribe, and just keep watching it, and stay tuned for more videos. This will keep me motivated. Thank you very much.